Hi, I'm Dr. Yemelaknesh Wolde. I've spent the majority of the last 10 years working as a health financing and system strengthening advisor, working alongside governments and partner organizations. My leadership project focused on exploring enablers and barriers to women's leadership in health financing, specifically in East Africa. Globally, women make up the majority of the health workforce, yet they remain underrepresented in leadership roles. This gap seems particularly pronounced in health financing spaces where decisions about budgets, priorities, and trade-offs are made. As global health increasingly shifted from vertical programs towards broader systems level approaches, health financing has become more central. Yet it's still often perceived as a highly technical, male dominated space. That perception continues to shape who is seen as credible, who's invited into decision making, and whose leadership is cultivated. At the same time, evidence from development economics and public health shows that when women control resources, investments tend to benefit families and communities. There is no reason why this logic should not extend to the field of health financing. This work is especially timely as we're living through donor shifts, funding uncertainty, and increased pressure on governments to make strategic health decisions with fewer resources. In moments like this, leadership pathways don't just change. They may either become more constrained or intentionally opened. This project also emerged during a moment of transition for myself, navigating caregiving, a forced career shift, and professional uncertainty, which not only shaped the questions I asked, but also reinforced my conviction that this lens matters now more than ever. This project is ongoing, and some of the findings that I'll be sharing today are drawn from an online questionnaire that I administered to 22 professionals working in or adjacent to health financing across East Africa. The questionnaire used ranked questions to examine leadership barriers and enablers. Respondents represented a mix of gender, sectors, and country context, largely grounded in system-facing roles. Across the questionnaire, about 90% of the respondents agreed that barriers to women's leadership in health financing exist. What matters is where those barriers are often experienced. And some of the most frequently ranked barriers at the individual and organizational levels are presented here. What emerged is not a simple division between individual and organizational barriers, but also a close connection between them, where organizational context often shapes how individual challenges are experienced. Across the questionnaire, respondents were also very clear about what would most support women's advancement. At the individual level, the most frequently ranked enablers were mentorship and sponsorship, access to professional networks, visibility in leadership and decision-making roles. Taken together, this finding suggests that women's leadership in health financing is less a pipeline issue and more about how access, opportunity, and leadership pathways are intentionally designed. While mentorship emerged as a strong enabler, respondents were also very clear that informal or ad hoc mentorship is often fragile and uneven. What emerged instead was the need for intentional approach, one that combines structured support, institutional buy-in, and blended models that connects peer support with access to senior leaders who can provide visibility and sponsorship. One respondent captured this very clearly, noting that because health financing is still a relatively new field, spaces for mentorship and professional exchange remain limited, and that for women, visibility, voice, and access to senior figures are especially critical. Building on this, the next phase of the project will involve key informant interview with women working in health financing across East Africa to co-design mentorship structure grounded in regional realities. During this project, there was a moment when I genuinely questioned whether focusing on women's leadership in health financing was still relevant, given how disrupted the global health landscape seems. What helped me move Through that doubt were conversations with my coach, with my former colleagues, with women working in the field, and WomenLift Health cohort members. Those conversations clarified something important. In moments of disruption like this one we're living in, leadership that centers communities becomes even more critical. This project reinforced for me that leadership is not about titles or certainty. It begins with trusting my own voice, staying grounded in lived experience, and choosing to lead in ways that reflect community priorities, especially when systems are under strain. What I'm carrying forward is a deeper conviction that when women are supported to lead, they don't just manage resources. They help shape decisions that better serve families, communities, and the health system as a whole. Thank you.